beg leave to ask the question standing in my name on the order paper.
My Lords, the current smoking rates in Sweden are 13%, compared to England, where the rate is 14.9%, and across the UK, 15.1%. There are no current plans to visit Sweden. Smoking levels are at the lowest level recorded in England, but we are not complacent and remain committed to reducing the smoking rate to 12% or less by 2022, as outlined in the Tobacco Control Plan for England.
My Lords, I thank my noble friend for that reply. She will be aware that the policy of harm reduction, whereby a new technology that is less harmful is used to displace a more harmful technology, was pioneered in this country by the Lord Speaker when he was Health Secretary in the 1980s with respect to needle exchanges and HIV, and has since proved also very effective in the introduction of e-cigarettes. But in Sweden, where the adult smoking rate is now down to 5%, this is because of another harm reduction technology, Snus, the little sort of tea bag of tobacco, snuff tobacco that you press against your gum, and which is widely used in Sweden, and as a result they have low lung cancer rates. But because it's banned in the EU, we are not currently able to follow, and we could follow and save tens of thousands of lives if we were to legalise this technology when we leave the EU at the end of next week.
Well, I thank my noble friend for his question, and I join him in paying tribute to the Lord Speaker's role in harm reduction. I would just open by making the point that no tobacco product is safe to consume due to its links to cancers. And Snus is banned, as he rightly says, under the EU Tobacco Products Directive as an oral product, except in Sweden. We have made a commitment under the Tobacco Control Plan that following EU exit, the government will consider reviewing the position on Snus and whether the introduction of the product to the UK market would promote the kind of proportionate harm reduction approach that he proposes. However, I would make the point that there is no evidence that Snus in Sweden has reduced smoking rates, and so this is very much under review.
I think it's important to say that snuff is actually snuff. Let's be quite clear, this is snuff. This is a tobacco product that we're talking about here. And that it seems slightly odd to me that the noble Viscount might be suggesting that we should swap one very carcinogenic product for one which might be slightly less carcinogenic and only give you mouth and throat cancer. The question I would like to ask the noble lady, the Minister, is would she commit that the review of tobacco regulation will include an assessment of the continuing attempts by major tobacco companies to market their brand identities through advertising campaigns and sponsorship, for example, through Formula One? And indeed, one of her colleagues had to write to Philip Morris, which make Marlboro cigarettes, telling them to remove poster adverts for healthier tobacco products from shops around the UK quite recently.
Well, I thank the noble Baroness for this question. Smoking remains the biggest cause of death in this country. There are strict rules in place to prevent tobacco countries from promoting their products, including through sponsorship. We take the unlawful promotion of tobacco products extremely seriously, and we expect any organisation found to be flouting the rules to be investigated.
My Lords, while snus contains both nicotine and tobacco, and that's why the Swedes use it. It has, whether using snus or any other reason, but it has reduced lung cancer rates in Sweden. And that's the main thing that we should be talking about. What strategies do we have to reduce our lung cancer rates, which run at about 35,000 a year? And tobacco is the key cause, and 80% of it is related to tobacco. So whether it's snus or e-cigarettes or any other strategy for harm reduction is what we should be thinking about. What the Minister agreed. Well done.
Well, I thank the noble lord for his intervention and for his expertise in this area. And he is absolutely right that we need to be targeting a reduction in lung cancer rates. Cancer Research UK states that smoking tobacco is the biggest cause of lung cancer in the UK, with 7 out of 10 lung cancers caused by smoking. So the NHS long-term plan has had a very heavy emphasis on prevention, including smoking cessation services. And one of the first interventions from that plan to be rolled out is our initiative on the innovative targeted lung health check, which will provide an easy access gateway on lung health and smoking cessation services. And I hope that he is reassured by that answer.
This side. My lords. This side. My lords. This side. My lords. My lords. This side.
Thank you. My lord, Sweden has banned the advertising of tobacco products, introduced clean indoor air laws, and increased the price of cigarettes. Together with properly regulated promotion of e-cigarettes, aren't these measures shown across the world to be the best methods of tobacco control? And isn't there a real danger with products such as snus that tobacco companies want to promote dual use of them, pushing potentially dangerous tobacco products in clean air environments and continuing to push traditional tobacco smoking products elsewhere?
Yeah.
Well, the noble lord is right that e-cigarettes have proven to be a beneficial aid in quitting smoking, but I would like to emphasise the fact that the best thing a smoker can do for their health is to quit smoking entirely, and that is the priority of the tobacco control plan and the measures which are pushed through the NHS and other means. But in the UK, about 5.5% of adults currently are using e-cigarettes. That's about 2.2 million, and it has proven to be an effective means of quitting smoking. That is why we did encourage this route through the tobacco control plan, and we will continue to do so.
My lords, 5 years ago I used to smoke 50 cigarettes a day. Since then I took up vaping and I haven't had a puff of tobacco since. Shouldn't the government do more to encourage smokers to switch to vaping?
I would like to emphasise to the House that smoking rates are now at their lowest levels recorded, and we should be proud of the fact that the UK is seen as a world leader in tobacco control. No, but we are not complacent in any measure by this, because there is variation amongst different groups and across the country. This is why the long-term plan has a commitment to do more to target smokers in NHS care, why NHS health checks offer an opportunity to continue to smokers to quit, why PHSE backs the Stoptober very successful campaign, why we are introducing smoke-free prisons, why we are introducing interventions for those within the mental health care system, and why we are introducing a new smoke-free pregnancy pathway. This is to ensure that we continue to reduce smoking within the UK.
To look at the experience in Scotland 20 years ago, because a factory was opened which produced these small tobacco pouches, and it was closed down within a year, and I was one of the people responsible, because of the incidence of mouth cancer. And we saw it from the United States and elsewhere that mouth cancer is caused by sucking these pouches. It really is a crazy suggestion that's coming from opposite.
I thank the noble lord for his point. I shall certainly look at the experience of Scotland. There will be an evidence-based review which will look at the risks as well as at the proposals.